aversions to me recording this. Fantastic, thanks very much. Welcome one and all. Sorry, Hayley, it's you. Welcome one and all. I'm just going to share my screen. Thank you very much for attending the AGPT Intake 2 regional webinar with MCCC. I wanted to welcome all our guests tonight, and we'll be hearing from each and every one of them as we go through the webinar. The purpose of this webinar really is to help you in your decision making. We're getting very close to the closing date for the AGP Intake 2. As you will be aware, it closes on the 21st of September. So I would imagine that if you are progressing your application at the moment, that you may have some stuff to do over the weekend. So we look forward to being able to inform you with this webinar today to help you make those decisions. As you know, the AGPT practice training program involves 2 GP colleges, but today we're focusing on the intake related to the Royal Australian College of General Practitioners, RACGP. You also may know that MCCC is one of 2 GP training organisations in Victoria, and we cover more than 50% of regional Victoria, which we'll look at very soon. As you can see, the Western Victoria, the northwestern area, training area of MCCC's footprint basically spans from the boundaries of Melbourne in the south across to Horsham, up to Mildura and across to Moama and Echuca and down to Gisborne. So it's a huge area, and we're delighted to have people who know this area really well with us tonight to be able to tell you about the opportunities. Lynn Marie, who is our Registrar Education Support Coordinator. She'll be telling you a little bit about the amazing opportunities that there are in this northwest region. I think there are about 59 or 60 practices that are available in the northwest for training, and I'm looking forward to Gemma Bellardi, who is the VRGP coordinator for Loddon Mallee, talking about the advanced skills post opportunities in the Loddon Mallee, and also Kim might like to mention some of those types of advanced skills opportunities in the Grampians region with VRGP as well. So I'm not going to go too deeply into this, because I think you're at the stage where you're making a decision. You've already thought about what GP has to offer. We do know that, and I'm sure you can back this up, is that GP, particularly the continuity of care and the variety and flexibility and the autonomy once throughout your training, and then once you've finished training, is one of the key benefits of becoming a GP. And as you're probably knowing at this stage, that applying to AGPT can occur during your junior or hospital medical officer years, or any time during your medical career. And that this, as I mentioned, is the second intake for 2022. And we're looking to support your RACGP application today. Again, I'm sure, because I know all of you have registered as interns or JMOs, that you will be aware that the training is based on an apprenticeship model, that it is in practice teaching by qualified supervisors. And one of the key things that our registrars seem to appreciate, and I'll be interested to hear about Laura's experience very shortly, who I'll introduce you to. but is the training and the expertise of MCCC supervisors. It's been a real highlight for many people who they've reported that the high quality of supervision has really made a huge difference to their training with MCCC. As you can see, we're focusing on the RACGP pathway tonight. In year 1, hospital training or RPL, and I won't go too much into detail, but year 2 and 3, there's the GP training terms 1 and 2, 3, the 6 months in year 3, and an extended skills opportunity for 6 months also in year 3, and with the option, which I'm keen to get Kim and Gemma to talk about, the option of advanced skills in the 12-month fellowship with FAR GP in year 4 and a consolidation of skills in year 5. So I think I was going to hand over to, actually I might hand over to Laura at this stage. Laura, would you like to tell us a little bit about your training? I'm just going to stop sharing this for a moment. And tell us a little bit about your training in the Northwest, and why did you choose to go rural?
Yeah, absolutely. So as a bit of a context, I'm a GPT 3 currently in Mildura, and I completed my GPT 1 and 2 in Mildura. Prior to that, I did my internship and residency at Bendigo Health, and applied for the GP training program to the College of GPs, got on and decided that 2 years in the hospital wasn't long enough. I wanted to do a 3rd year. So I actually, whilst on the AGPT program, went up to Alice Springs for 12 months as my hospital year. And then after that, which was incredible, after that, returned to Mildura and started GP training here. So I picked Mildura for a number of reasons. My family is from Barranwood, which is 2 hours away in country New South Wales, and my parents are kind of retiring here, so family was a big one. And I guess the second reason was that I love Bendigo. It was great, but Bendigo is very much a big city in my books. Mildura is a bit smaller, but not too small. So for those who haven't been or don't know the town well, we do have 2 hospitals, a base and a private. And the GP clinics are very sort of standalone, like you don't have to work at the hospital like you do in some smaller towns, where often the GPs will run the hospital. So it's big enough that kind of I'm just able to do clinic work, which is more than enough and what I want to do. But we do still have specialty services visiting. I guess the other thing is as well, because we don't have as many tertiary sort of level specialists or services as Bendigo, there is a lot of scope for like a special interest general practice as well, which is really exciting. So some GPs will do like GP O&G or run like the hospital in the home program or palliative care. So there's really that capacity for sort of specialist GP if you've got niche areas of interest. I think another important sort of point I'd like to make is that Mildura is amazing. Definitely come and work here. A lot of people will be put off by the distance. It is quite far away from Melbourne, but I've really found that's been no barrier to opportunities in my training. My other job is doing the Registrar Medical Educator position with MCCC in the Northwest Division. So I currently work part-time in my clinic out in Redcliffs and part-time with MCCC. So it's fantastic. This morning I was on the webinars teaching the GPT 1s and 2s, and it was never any issue that I was in Mildura. When I did the interview process, it was kind of just like, oh, you don't mind driving, do you? No worries. And I'll come down for occasional workshops in Bendigo, COVID permitting. but really being up here was no barrier to getting that position. And I think that's another wonderful thing about general practice is the scope. So you can do your clinical work, you can do your non-clinical work, and all being well with my exams and whatnot, I'll hopefully stay on with MCCC as a medical educator next year, post-fellowship. So
is that something that you even knew about before you started your training? Did you even consider that there would be a role for you in medical education?
No, in fact, I even remember when the last year's registrar medical educator was saying, "Oh, just think about it." I distinctly remember thinking, "Nah, I'll never do that." Yeah, so I need to eat those words.
But it is fascinating, because I know we've had other medical educators on in the series of webinars, and it's been one of the most rewarding things for people to be involved in.
Yeah, it's fantastic. And I think it makes you a better clinician too, because you are, I guess, like, you're consolidating your knowledge, and there is this level of like, you have to understand something well to teach it and to be able to communicate that, and it makes your communication skills better with patients. So yeah, I think it's a fantastic job. I love it. Yeah.
So can you describe the rural pathway that you're on? You are on a rural or an RG FAR GP pathway?
Yeah, so I'm not doing FAR GP. I'm just doing the rural pathway.
Yep.
Yeah. So yeah.
So where do you see that taking you, Laura?
Yeah. I told my current clinic are keeping me on next year again, all being well with exams or whatnot. But probably in very, very similar capacity to how I'm working now, a few days in the clinic, and the rest of my time in medical education with MCCC. And even probably we've got a Monash School of Rural Health here. They've approached me about teaching with them also. So probably a split between them and MCCC for the rest of my time.
And in the longer term, have you got any aspirations?
Oh no, I'm very superstitious. I might jinx them if I say. I'm quite interested.
You can hint at them.
I'm quite interested in like trans and gender diverse health. So that's something like a bit of a special interest of mine, and something we don't have any support or services from here in Mildura. So that's something I'd be interested in, I guess, starting up or trying to develop up here. But I'll say no more for fear of jinxing.
No, don't jinx yourself. We don't want that to happen. So how are you finding your training experience with MCCC?
Yeah, so from a clinic point of view, I absolutely adore my current clinic. They are wonderful. The teaching is great. I have 2 supervisors that are both very available and supportive, and just fantastic. Like I can't sing their praises more. Especially there's 2 registrars there, myself and another GPT3, and my supervisor's been incredible with exam sort of focused learning, because I've just sat my writtens, and she will be sitting early next year. Very conscientious of what we need to achieve fellowship, very approachable with any questions we have, and there's nothing too silly to ask or get into him or her to come in and have a look at. They've been wonderful. Yeah.
That's fantastic. And my big challenge to you, what are the 5 top tips for making a life and a living as a rural trainee? What are the secrets to do, or have you achieved work-life balance? Or are you trying to achieve work-life balance?
Okay, I can do this. Number 1, join the running group. I joined the local running group here, and it's so good. They're such a lovely community, and I've made so many friends like outside of medicine through them, which is great, especially when you're studying for exams, because you need those outlets. Yeah, so join like a local sports team or something. That's been fantastic. If you move here, house prices are really reasonable. So I bought my first home here. So that was very exciting, and really makes you feel like, oh, this is home. Like, I'm settled here now. I think Mildura is a lovely place too. Like we're on the river. There's a lot of sort of national parks nearby. You can get out of town and do other things. So all those sort of opportunities like give you some incentive to get out and do things with my weekend and explore and have fun. What was the second part? There was life and
just your 5 top tips for making a life and a living as a rural trainee. So we talked about running. That was very important. By being able to buy settle down in the community and buying a home, really getting into that. Anything else in terms of making it work in terms of your daily schedule, or are there any particular tips that you can pass on around that?
Yeah, I think like valuing your time too, especially if you're coming from the hospital, you know, overtime, all that unpaid sort of work that you do. With general practice, you can be more firm about your boundaries and the hours you want to work. So that's really important too. I guess just doing what makes you happy too. Like for me, clinical work, I was full-time clinical last year and it was great, but exhausting. So to make the decision to do the 50-50 split between clinical and non-clinical in the education, I have no regrets. That was the best choice for me. And again, you can do that with general practice. Like there's so many options. It's great.
Thank you so much. There's one more question that I wanted to ask you is, you know, sort of thinking back to, you know, when you were applying for AGPT, is there anything that you know now that you wish you'd known then? I'm putting you a bit on the spot because I didn't give you that talking point, but I'm just wondering, is there, you know, thinking back now, what would you like to have known a little bit more about as you were applying for AGPT?
I think, and maybe it's not I wish I'd known, but some really good advice I got from whoever it was I spoke to at MCCC at the time. I can't remember, sorry, because I didn't know you were well, but when I was applying,
it was Lynn Marie. Yeah.
Lynn Marie told me her words of wisdom was actually not to hurry going into general practice, because I was very much in my resident year. I was like, oh, okay, well, I have to get the ball rolling, be a GP. And they actually said, oh, well, have you done any peds? Have you done any women's? Like, would you consider another sort of hospital year to consolidate your knowledge? And I am so grateful for it, because GP is a big sort of step from the hospital environment. You're very, I guess, supported and sheltered almost, to suddenly it's you in a room with a patient. It's like the more clinical experience and exposure you have behind you, like it's only a good thing. So don't feel you sort of have to rush into the clinic. Take your time, dabble in, you know, specialties you're interested in, and you'll be a much better GP for it. Yeah.
Thank you, Laura. Anything else you want to add?
My parting note would just be like, please consider Mildura. I know we're far away, but like it's a really good centre. And even if you come up for 12 months and, you know, decide it's not for you, at least give it a go, because everyone that comes here ends up having a really good time. We've got a lovely community. I reckon you'll be pleasantly surprised.
And there are quite a lot of practices, and I'll get Lynn Marie to talk about that after Jerry and Gemma, but there are quite a lot of really interesting practices, because Mildura is what, about 50-60,000 people or smaller? I don't know, but it's not a small place, is it?
No, and we have drainage too, because we're a border town. We get, you know, we have Wentworth and Baronga and Golgol, like some of these drainage areas too. So yeah, we're quite a big community. Yeah.
Excellent. Thank you so much, Dr. Laura Nield. We really appreciate it. I know I just want to tell everybody that your spot on social media has been the most popular spot in all of MCCC history. More than 4,000 people have looked at your videos. So talking about attracting people to Mildura, we really appreciate the work that you've done. And for anyone listening to the call, make sure that you put Mildura #1. There are plenty of other places, but we do love you to look at, and also at Echuca. And I am about to call on Jerry, but I notice he is on a phone call, so I might flip over to Gemma and then come back to Jerry. Gemma, how are you? You're on mute.
Very well,
so I want to introduce Gemma Bellardi. Actually, Jerry, are you right to present?
Yes, can you hear me?
Okay, sorry. Yes, I just saw you were on the phone, and I thought, uh-oh. So Gemma, I'm sorry to bump you back. Thank you. Jerry, we are recording this for people who've registered tonight. We've had a mix of this happening throughout the webinar series where people are really interested to watch the recordings but not be on the call. So we're proceeding as if we have an audience, which we will, I'm sure. So I'll just bring up your slideshow. Would you like to introduce yourself, Dr. Jerry Wong from Echuca?
Yeah. Sure. Yeah, so I'm Jerry. I'm living in Echuca, and I've been here 5 to 6 years now. So I started off at Melbourne Uni, and then after that, for my first 3 years, I went to Ballarat Hospital, where I did my internship and then a couple of years of residency. So this is back in 2013, in my intern year, coming to visit Echuca for a holiday. And Echuca is famous for Murray River and paddle steamers. So I look a lot less stressed than I am now, probably, and a lot better slept without children as well. So yeah, that was my intern year. And then for the 2 years after that, I did some peds, and then I did my diploma of obstetrics. And then another 12 months of obstetrics, doing the advanced diploma, which involves like doing Caesars and instrumental births. So I wanted to get all that done and out of the way before I went on to my GP training, and that's when I came into Echuca. So these are the places that I'm working at. So the top one is just our practice in Echuca. We have another site in Moama, which is the one underneath that, across the border in New South Wales. So there's always sometimes some difficulty with the border issues and slightly different rules and all that, but 2 different sites. And then Echuca Hospital, where I'm on call for ED occasionally and also for obstetrics. And then the bottom right is Nernda Medical Centre, the Aboriginal Health Service. So in terms of my week, Monday, Tuesdays and Thursdays, 3 days a week, I'm at the private practice, which is a Echuca Moama family medical practice. So that's Monday, Tuesday, Thursday, where I work from about 9 till 4 o'clock. I finish a bit early so that I can get home earlier to have dinner with everyone else at home. And the hospital, yeah, we're just on this roster of at least once a month on call for the ED, and then about once a week for obstetrics. And on Fridays, I work at Nernda, the Aboriginal Health Service. So all up, you can see that's 4 days a week plus some on calls, and Wednesdays off. I was asked to talk about a typical day in my work, and I was going to just write down the patients I saw today, you know, roughly what they were for, but
and Jerry, just let me know when you need me to advance your slide.
Yeah, and basically I've spent the whole day here on maternity ward because I had an induction in the morning. Then I saw some patients, I was supervising the intern, then I got called back in because there was a lady in labour who was breech. So I went and did her Caesar, and now the baby's still here getting transferred to Royal Women's now. So had to cancel all my patients in the afternoon. So some days are like that. Some days I just appreciate knowing I can go into the clinic 9 till 4, see my patients, you know, no medical students, no supervision, no on-calls, no one can interrupt me with my phone calls, and just see my, you know, 15-minute appointments. But some days are like this, and it's just a variety, which is exciting, but it also, yeah, it can be challenging as well. And I think with all the GPs talk about severity in the patients that you see, you know, from babies to palliative care. But I really appreciate the variety in the work that you can be involved in as well. So whether that's private practice, Aboriginal health, on-call work, some of the doctors do ward rounds and nursing home visits, which I don't do. And then there's a supervision and education side of things. So if you just flip to the next slide, one of the things that I do enjoy doing is, this is actually not a real patient, it's all fake. We were practicing obstetric emergency. We was doing this last Friday. So we do scenarios and yeah, it's a lot of fun. it's really good practicing our teamwork, and that's probably one of the things I appreciate most about working as a rural GP, that you know the staff you're working with, whether it's the nurses, admin staff, reception staff, other doctors. And so when you're making referrals or asking for help, you know, the people you know and trust. And even if they're not on call, I've called doctors in multiple times to give me a hand when I'm really stuck, and everyone's happy to do that. So just the next page. So that one was practicing a PPH, or massive blood loss at a Caesar, and this one is suddenly neonatal resus, and I'm not sure on the left, something's happening there as well. So when it's just good to break up your week doing a few different things. We just go to the next slide as well. I think I've got one more. And the thing, you know, in different seasons, I think appreciate different things about being a rural GP. Initially, it was, you know, I picked this pathway because just, yeah, what I've talked about already, the variety and the different things you can do, and the challenge of, you know, you can explore different areas that if you want to specialize a bit more and do a bit more professional development, and you can do, you know, kind of any topic you want, and make that your little kind of area. And it's really satisfying when you can do a lot for the patient before you send them to a specialist, because they don't really want to travel, you know, hours away to see a specialist. And it is quite satisfying when they go there and there's like nothing much that they can offer more than what you've done already. So it means you've done a really good job. So, you know, for a GP, you can be a very kind of minimum pass GP where you do what you need to and you're safe, but there's an opportunity, especially in the country, to do a lot more than that, and to be a really good GP that people will respect and appreciate as well. So, you know, that was initially probably why I got into it, but these days I appreciate the flexibility in my work days, getting to finish early, not working Wednesdays. I used to not work Tuesdays too, so I was working 3 days a week for about 6 months when we had our 4th. So, you know, we that was during lockdown, that we just went on lots of bike rides. I went down to the river. So that flexibility in having time for family and other things as well. And the longer I've been here, I've just enjoyed getting to know the community, in the sense that a lot of my patients, you know, I see at the kids' school or preschool or swimming lessons. And I think initially when you come here, you're a bit daunted by that you're supposed to be the doctor and there's supposed to be this boundary, and there always is. But they do become your friends a little bit more because you're seeing them as, you know, doctor and patient, but not just that, you're seeing them in the community, and the kids are in the same classroom, and you're going to swimming lessons together or going to the gym together, that sort of thing. And so, you know, that part of it I really appreciate in this season, and I'm sure it'll change over time. But yeah, those are some of the things that I thought of as to why I'm here and why I'm doing what I'm doing at the moment.
Jerry, can I just ask, you know, as a GP with a family, how does it work for you in Echuca? You know, how are you finding, because some people are really concerned that there won't be the opportunities, you know, and the level of schooling and the access to things that they want for their children. How have you found that?
Yeah, I think that's one of the biggest barriers to doctors coming to the country. And you know, if there was any advice, it would be, you know, work is only part of your life. And if, you know, we've all got to think about what else is happening, just your family circumstances and personal situation as to what's going to work. And I think the partner, finding work in the country is a big thing, and it's hard to watch registrars, you know, drive back to Melbourne every weekend and, you know, not see their kids for the whole week. It's workable, but it's very hard for that to work. So, you know, things do have to work, not just for work, but for your whole life and family. And, you know, this season, the kids at preschool, primary school, you know, there's really good schools for that here, and they have a great upbringing. But yeah, high school, it may be different. So again, that's how things just change with the seasons. But at this time, it works well for us. And yeah, I guess my only thing is just, you know, think about all that and how it's all going to work. You might not have all the answers, but you know, it's working well for us at the moment. And it's a really nice place to live in the Chukamama. And one of the things why I came here actually is because there's so many other procedural GPs, whether it's anaesthetists or obstetricians. I didn't want to go to a town where I was on call every second night. I can't remember if there's 8 to 10 GP obstetricians, which is quite rare, but it's one of the reasons why I picked to come here, so that we can all share the load, and I'd have plenty of people to learn from and call upon.
And just one final question. Oh, actually, I've got two, and I know we're just running a little bit behind because we started a little bit late, but I've just firstly wanted to ask you your experience in an Aboriginal community controlled health service. Can you tell me a little bit about that? Because that's been one of your areas of real interest and contribution. Oh, you're on mute, Jerry.
Sorry, can you hear me now?
Yes, thanks. Yep.
So part of starting work at the Aboriginal Health Service was because in the RACGP training, you had to go to 2 different practices. So in my second year, I started there, and I've stayed on since, because I just enjoy the people there. It's a different pace, different way of working. But there is a real need, we all know, in Aboriginal health, and that the health outcomes are just not the same. And I think we all have an obligation to help in whatever way we can. I think that's why we went to medicine in the first place, to help people. And so there's a great need there. And some days it's really challenging that you feel like you do all this work and maybe the patient doesn't come back, or it doesn't quite work out. But then I know that there are quite a few patients where I'm so glad that I've been there through their pregnancy in particular, and they've had a good outcome because of it, and just know that, hey, all that work has been worth it, and you are making difference in these people's lives. So yeah, I encourage everyone to at least have a go. It's not a cup of tea for everyone. It does require some flexibility, and just letting and working with different people, different culture, not just patients. This is just how the system works, and the practice and the staff. But yeah, is a chance to make a big difference as well.
Thank you, Jerry. And one final question. It doesn't need to be 5, but your top tips for making a life and a living as a GP in regional Victoria. What's your big advice to people who are on that threshold of making the leap?
I don't really have 5.
It can even be 1.
Yeah, the main thing I was thinking of is just think about how it's all going to work with your family, and if you do have a partner and all that, because that's the difference between whether you continue with this journey of working in the country or whether it just really doesn't work. And talk to heaps of people that's done it before, explore all your options in terms of locations. And I was thinking about going to Ararat at one stage, or Western Victoria, because they do really good obstetrics there as well. I know there's a good team there in Ararat. So just explore what the options might be. How does it work for you, for your work, but also for your family and your personal life? And talk to heaps of people who've done it before, and you'll get a sense if this is the right place for you or not.
That is sensational. Thank you, Dr. Jerry Wong, for your great presentation and the advice that you've given our participants tonight. Hopefully this will make a big difference to their entry into their career as a GP or a GP RG. And thank you. We won't keep you any longer because we know that you've had a big day and with babies. And thank you so much for your contribution. We really appreciate it.
Thank you.
Thank you. Next, I'd like to call upon Gemma Bellardi, who is VRGP Coordinator for Loddon Mallee. And Gemma, tell us a little bit about VRGP in Loddon Mallee. Well, first of all, VRGP in Loddon Mallee, and the opportunities that are available and the pathways that are on offer. And Happy, I think you're good to go if you need to share the screen. You're on mute.
This happened before. Thanks for having me. So the VRGP, or the Victorian Rural Generalist Program, has recently been redefined and established statewide across Victoria. We have clinical leads, a head clinical lead, a statewide coordinator, and 5 coordinators across the state, me being one of them in Loddon Mallee, and Kim, the lovely Kim, being one in the Grampians. So what this basically means is that the VRGP is a pathway designed for trainees that wish to become rural generalists. So a rural generalist is a general practitioner with a skill, an additional skill, whether that be anaesthetics, obstetrics, as per Jerry as well. We also do things like paediatrics and mental health. And what we now do is we have basically, there's a 3 to 4 years that you are under the VRGP before you start in your GP training. That comes from intern year. So from intern year, there are funded positions across the state. There's funded positions in the Loddon Mallee. There's 5 funded positions at Echuca Regional Health. And there's also funded positions elsewhere. We then have funded positions in PGY2. And what we do is we work with you from intern year all the way through to when you enter the college to secure the right rotations that you'll need in order to become a rural generalist. So many of the colleges require paediatrics, obstetrics before you enter the VRGP. So we support you to basically get those rotations. And my role and Kim's role is as case managers. So we case manage right from the beginning, and it can be very variant on what we need to do to support. Sometimes it's about visas, sometimes it's about family, sometimes it's about contracts, but we basically create a pathway all the way through the Loddon Mallee region. So you might be doing a year in Echuca, or you might decide to do your whole 3 years in Echuca. You may also decide you want to try a bit in Mildura. So we work across the whole region to make that happen. Oh, you're on mute now, Anna. Loved saying that.
I know, fantastic. I was just going to invite Kim just to mention, we have Kim Lane, who is VRGP coordinator for Grampians, and Loddon Mallee and Grampians sit side by side in the northwest region of Victoria and work together. Kim, do you want to just talk about some of the opportunities in the Grampians, because you are the counterpart to Gemma?
I am, and I'm relatively new in the role, so my knowledge is not as good as Gemma's. But we have the same training opportunities. We have funded positions for PGY2. We have the intern program that feeds out of Ararat, St John of God, and Ballarat and Maryborough. And that whole pathway can start from when you're like a Deakin medical student. You can come the full way through and become an RG. And as Gemma said, we case manage you to be able to assist you in every step of your journey. So any issues that you're having along the way, that's what we're there for, to try and make that pathway clearer for you, just so that you can not have to worry about some of the things that seem insignificant to some, but stalling your ability to get where you need to be. So that's our job.
And can I ask either of you to answer this? I'm keen, and it's been one of the areas of confusion for people when they're choosing an RG pathway as opposed to a rural pathway with AGPT. Can you just explain the training in MM3 and above? Just about, how that works with a lateral entry into the VRGP program.
I'm assuming Kim wants me to answer that. So basically, obviously, a rural generalist, the skill that you have being a rural generalist needs to be used in a community. So, for example, you may do a year training in anaesthetics in Bendigo Health, but you can't then utilise that skill if you stay in Bendigo and live in Bendigo. So what you need to do is then consolidate that skill after your advanced year. So, and that's normally around year 3 or year 4 of your hospital time. that you'll do your advanced year. And then after that, you need to go and work in an MM4 or above to consolidate your skill, because that's actually the purpose of what the rural generalist is. They work exactly like how Jerry said. Baby comes in, it's breached, they manage the situation until they can either manage it solely there or get them to the next place that needs to happen. So you do need to understand that when you're looking at becoming a rural generalist, that a rural generalist doesn't sit in Bendigo or Ballarat. They sit further out in the community, and that's their essential part. So that is an essential part of the training.
Thank you very much. That's terrific. I was going to ask a question, and now it's gone completely from my head, which is just what you want to have happen. It was about, yes. So basically, if people want lateral entry through, and Lynn Marie was going to talk about this a little bit later as well, but if people want lateral entry into an advanced skills post, if they're practice ready, can you just talk a little bit about that and what opportunities there might be in the coming year for that, and in what time frame?
2022,
yes,
what positions might be available?
If people are practice ready, yes.
Yeah, if you're practice ready, then obviously. So Lynn Marie and myself work closely together around trainees, and that's part of the case management and support that we offer, so that we're always talking about what's coming up. So in the Loddon Mallee, we actually only have 2 posts left for 2022. One is which is paediatrics in Mildura, and the other one is a joint post between Bendigo and Echuca in emergency. So that's currently what we have available, lateral entry, if you're practice ready. Kim might know which ones. I'm not sure of which ones are available in the Grampians, sorry.
Yeah, no, we only have one position that's available at the moment, and that's in paediatrics, and that's based in Ballarat Health.
Brilliant. What I also just wanted to finish off on is people can actually connect with you right now before they apply for AGPT. I will be sending out an email with all contacts and information, particularly about VRGP, the final days of applying to AGPT2. But tell us what happens if somebody hits the express interest on the VRGP website, the link that I'll send them. What experience will they have? What can they expect?
Well, if it doesn't go into junk mail, they can expect us to respond to them. So that's a good start. So what they can, if they express an interest and let us know which region they're interested in, our statewide administrator, Kate Carlisle, will get in contact with whichever coordinator it is, and they can anticipate either a phone call or an email and starting to work with them around what they're looking for, what support we can do, or what placements are available. And we even sort of just talk about where they see their career going as a rural generalist.
Yeah.
And sometimes it might be that I want to be in Loddon Mallee for 1 year, but then I want to go to the Hume, and that's okay too, or the Grampians. So it's not, it's not this, the beauty of the VRGP is it's flexible and we work collaboratively, and you have the ability to say what you want, and we will try our best to make that happen.
Thank you very much. Kim, any last words of wisdom that you'd like to add?
No, but it's a really worthwhile pathway. It's such a supported experience that if you are interested in living a rural lifestyle and being a special person in the community with those extra skills, then it's definitely worth exploring the option.
And thank you so much for you both turning up, Gemma and Kim. We really appreciate you telling us about the VRGP program, the lateral entry into ASP, and the pathways that are available for people. And I really would suggest, if you have even an inkling of interest in RG is to connect and express interest and have some valuable conversations with either Gemma or Kim, or in the other regions, the people that will be connected to you if you express interest on the VRGP website. Thank you so much.
Thank you for inviting us
making this
along,
time.
Anna. I'm going to have to drop off because I've got to join a quiz night.
I know. And this is the beauty of being part of a regional community. So
Sure.
thank you very
Thank
much.
you.
And we really appreciate you making time. And now I'm going to
Okay,
call
thank you.
on Lynn Marie Richards to introduce herself. And I'm also, so Lynn Marie, tell us a little bit about your role, and then I'll rev up the PowerPoint presentation. Tell us what you do at MCCC, and you're on mute.
Okay, so as the Registrar Education and Practice Support Coordinator, part of my role is to organise the placements for registrars across the region. So I'm in the Northwest region. So as Anna was saying, that goes from Gisborne all the way up to Mildura, out to Horsham, and everywhere in between. So part of my role is to also assess the practice readiness, so looking at what registrars have done in hospital and assessing whether or not they're ready to go into general practice or they need to spend more time in hospital. If the registrars are ready and they come into practice without spending time in hospital on the program, they apply for RPL, which I'll talk about in a moment, but I also am involved in the assessment process of that.
Can you tell me a little bit about the relationships you develop with registrars through the rural and RG pathway at MCCC? What will they expect you to do with them, or what will you be doing with them?
Well, I'm probably the first point of contact when they come in to the program. They get a welcome email from me and I introduce them to the team that they'll be working with. I have very close relationships with the registrars, really, because of the nature of the role. I do practice visits and I'll visit the registrars when they're in practice. Workshops, as I said, doing the hospital experience assessment, the RPLs, the registrars that are doing the advanced skills posts. I work with them as well, with the RACGP registrars, making sure that they've got their FAR GP enrolments in place prior to them starting in an advanced skill, and also monitoring the assessments, which are quarterly while they're in their advanced skills.
So can you tell us a little bit about the opportunities that are available in the Northwest? Particularly, there are huge numbers of general practices. Tell us just a little bit about that.
Well, I've got 63 general practices and 10 branch practices that are associated with them, so 73 altogether. And the diversity is amazing, really. The difference, as you can appreciate, you have several supervisors in a practice, and those supervisors might all have specific areas of interest and disciplines that they're interested in. So that can range from anything: dermatology, forensic medicine, mental health, women's health, sexual health, obstetrics, aged care, paediatrics. And then we've got extended skills posts that are in the community as well. So that could be sexual health, mental health, Aboriginal health. But the diversity of training. So, you know, once again, you've got practices that are large, that have got up to 15 supervisors in the practice. Wow. And then you'll have others that might only have 2 supervisors. So, and of course, the different regions, all the different locations. you're going to have a different cohort of patients in those areas. So it's very, very diverse across the whole region.
So just bear with me. So we just very briefly, we've touched on this already, but you can choose a rural or a rural generalist pathway. And I'm sure if you've got a week to go that you've probably been checking out your eligibility on the RACGP website, and that you can consider advanced skills that are optional with RACGP. But in particular, what I am very keen for Lynn Marie to talk about is the hospital experience assessment and how important that is to, once you have completed your application, how important it is to get that supporting evidence from the hospitals or hospital that you've served in. Can you tell us a little bit about what the hospital experience assessment is and how important it is to this process?
So the hospital experience assessment is looking at what disciplines the registrars have already completed in hospital. So we're looking at core rotations of Gen Med, Gen Surg, Emergency and Paediatrics, or the equivalent of those. And then we're looking for breadth of experience, so 3 other disciplines that could help to give you that basis to go into general practice, because as you can appreciate, you're getting a big presentation of different elements that are coming into you in general practice, as opposed to just being in one specific discipline in the hospital. So we're looking to assess that, and it's really important that you collect your statements of service from your hospital. We have copies of these. This is different to a letter of service. A statement of service has the dates of each rotation and the number of weeks that you have worked in that rotation, and presented in a numerical order so that it's very clear. So we're looking at that, and you need to have your first general registration with APRA, or be certainly about to get that. And so we're looking at making sure, as I said, that you've got that breadth. And then there's always a bit of, I'm just going to touch base here with the RPL. So just
how about, shall I go on to the RPL?
You can, yes.
Yep.
So just wanting to clear up that they're 2 very different processes.
Yep.
So the hospital experience, you're looking at the breadth of experience, so those core rotations and the other disciplines for breadth. Whereas with the RPL, if you have been deemed practice ready and you come into the program and go straight into general practice, you'll be required to submit an RPL application, and that is for the 12 months of hospital time that you are meant to be completing in the program. So you're not looking at breadth here, you're just looking at time. So they're 2 very different processes, and we are here to help you through them. Once again, with RPL, you are looking to have your HMO assessments, end of rotation assessments, your statements of service, very similar to the HEA, but specifically for those registrars who don't need to stay in hospital and complete any more rotations to be practice ready.
And so it is really important, particularly if you want to be deemed practice ready, to get in the AGP intake too, to get your either your hospital experience assessment primarily lodged in the MCCC portal as soon as you've finished your application, as soon as possible?
Correct.
Because when do you like to close off on that? It's about the 15th of October, isn't it? Or something, is it around that time?
I think Hayley, is Hayley still here?
Hayley is here, yes.
Yeah, Hayley,
So
you,
for the second intake, we've asked, I think it's the 1st of December for everyone to have submitted their HEA assessment via the portal by, I think it's the 1st of December.
Brilliant. Thank you very much for that. So, but as soon as possible means that everything can be put in place. So the 1st of December is the deadline that you absolutely want to not miss. But in essence, as soon as possible, Lynn Marie, wouldn't you say?
yes, please. Yes.
Yeah.
Yeah.
And
well, that way, so I'll just explain why. So if you are remaining in hospital, which as the second intake in the Northwest you will be, but the purpose for the hospital experience assessment is also so that you can be informed and contact your hospitals to get the rotations you need next year in order to be practice ready for when you come in 2023. So the sooner you can get that information to us, the sooner we can assess it and get back to you and tell you what you need so you can contact hospital and get the rotations that you need.
Is there anything else that you'd like to add before we go to the final slide?
No.
Usually we have a Q&A here, but we don't have anyone on the line tonight. But what I was going to say is that I'll put the contacts, which we have here. I'll put these contacts, not only will you get a link to this, the webinar recording, but these contacts, and I'll also provide the information, which is really comprehensive on the MCCC website, that will take you through to the RACGP application process if you haven't started that yet. And alternately, it has a whole range of step-by-step things to follow on the MCCC website. So I will put all of those links into the email that I send you all at the end of, I'll probably send that out tomorrow, which is the 17th of September, so that if you are still completing your AGPT Intake 2 application, you've got this webinar to hopefully help you make your decisions and hopefully answer any questions, particularly those are the key questions that we get around hospital experience assessment and RPL in particular. So I want to say a big thank you to all our wonderful presenters for tonight. It's been really terrific to have you all. There's been such a breadth of information and really fascinating stuff that we've learnt tonight. I know it will be helpful because I've been speaking to people who've been a part of the other webinars, participants, and just that ability to get the human face and the human information and to be able to hear people talk about it is so important. So I want to say thank you very much, one and all. As you can see, you can email us at info@MCCC, call our individual training hotline, which will also be in the email that I send you, and say thank you very much to our presenters, one and all, and we wish you all the best of luck with your AGPT application. There are 33 places available, or probably 30 by now. So there are a great number of opportunities in AGPT Intake 2. So thank you so much, one and all, and very much to our great presenters for tonight. And we look forward to seeing you at MCCC. Thank you. Good night.
Right.
Thanks, guys.